This is the Jerry Thompson Insurance Agency and Security Financial Bank halftime show. I'm Brian Winnekins. Halftime of our Durand Prescott boys football game. Joining us right now from the Pepin County Health Department, Meghan Sickel, and we're going to talk a little bit about some back to school safety stuff for the kids. School getting underway in many districts here in Western Wisconsin. And Meghan, thank you for joining us today. I know that the Durand, Arkansas School District, they had their back to school safe program that they have to do. And I know a lot of districts are having to do that. But for parents, what should they be taking from all of that? And what are some of the things they should be doing to keep the kids safe?
Absolutely. That's a great question. Thank you for having me, Brian. So there are some universal precautions to not only prevent COVID, but to also prevent other infectious diseases in the schools as well. The CDC recommends staying up to date on vaccines. This also includes childhood preventable diseases such as polio and pertussis. If you have any questions about how to receive a vaccine, you can always call your child's pediatrician, or you can always contact the health department. Staying home when sick, obviously, and if a child is presenting any COVID symptoms, to get them tested. We have free at-home COVID tests at the health department. You can always give us a call if you'd like to get one. And then also, just for general guidelines, the schools can also improve indoor ventilation, which they should already be doing. And then also just promoting good hand hygiene, especially at key points in the day. So encouraging your kids to wash their hands before eating lunch, whenever after they use the restroom, and then after recess as well. And then also just promoting really good respiratory etiquette. And what we mean by that is covering coughs and sneezes, what we've all learned through our entire lives. And then also just cleaning surfaces at least once a day. This also goes for the schools as well, just to get a Clorox wipe and wipe down all commonly touched surfaces as well. So those are just universal precautions. And then keeping up to date on community transmission levels. They can find this on the CDC's website. And it's by county, so you can look up Pepin County to see where transmission levels are. And if it's a really high transmission, you could always consider sending your child to school with a mask. Although masking is by person, if you feel comfortable masking, you are encouraged to do so. If you don't want to wear a mask, that's okay. And yeah.
Talking with Meghan Sickel with the Pepin County Health Department this morning. Meghan, really, for all of these different communicable diseases, whatever you want to call them, colds, flu, COVID, monkeypox, whatever. Is it really, shouldn't we just do what grandma taught us? And that's wash your hands. By the way, wash your hands. And oh, by the way, don't forget to wash your hands.
Pretty much. I mean, just keeping good hand hygiene is really key. And also, especially with COVID, since COVID can be transmitted on surfaces, that's also a really good idea. As for other respiratory illnesses, when we get into like cold and flu season, if your child is sick and there's no way to really, and they test negative for COVID and they can go back to school, maybe to prevent them spreading those germs is to possibly have the mask up. Masks have been shown to greatly reduce the transmission of influenza and colds. So if the child is able to mask and is old enough to keep the mask on, then we would highly encourage that.
Talking with Meghan Sickel with the Pepin County Health Department this morning. You mentioned one of those diseases, pertussis. I remember it as whooping cough. But we've seen increases in that. Is there some concerns about that with the health department?
We definitely do see it as a concern, especially since it's a vaccine preventable disease. That might suggest that less parents are vaccinating their kids against pertussis, and it's not a fun disease to have. It's really hard on the kid's body. It can be very dangerous, especially for younger children and infants. So we would highly recommend vaccinating your kids against pertussis, since that is very preventable, and it could really take a toll on the community since it is also very contagious.
And, we talk a lot about these respiratory diseases, but then there's things like measles, chicken pox and all that. And those are other diseases we kind of seem to are starting to see more increases of. Is it the same reason because of the whooping cough?
Yeah, a lot of it does have to do with vaccine rates. At least also we see it in America as well. The vaccine percentages have decreased, especially since the early 2000s with the measles kind of controversy. And so we still recommend getting your child vaccinated. If you have any questions about kind of vaccine safety and everything, you can always contact your child's pediatrician, or you can also contact the health department. Um, I know that we provide some vaccines at the health department. I can't remember off the top of my head which vaccines, but if you're ever curious, you can always give us a call.
Talking with Meghan Sickel with the Pepin County Health Department today. And Meghan, I know in the past, at least pre-COVID, the health department would do some like vaccination clinics with the schools. Is the health department getting geared up to potentially do that again, like it used to, as we move a little bit farther and farther away from everything we had to deal with the pandemic?
Yeah, we completely are planning on doing vaccine clinics. I think we'll be having a couple in October. I do know that. We can provide both COVID and influenza vaccines for schools if they would like us to come and do a vaccine clinic. I believe we are having a vaccine clinic on Thursday, August 25th, but I'd have to double check. And if you have any questions on when these clinics are, you can always call the health department. We'd be happy to answer any questions and like what kind of vaccines you would like to see there. We provide a good range of vaccines, I would say.
And a lot of time, well, and with any of these, the parents will get some type of a notification from the school district along with the permission slip and all of that. So it's not going to be something that just it's out of the blue. The parents should be notified of this before it actually happens, right?
Yes. Yep.
Talking with Meghan Sickel this morning with the Pepin County Health Department. Meghan, I'm going to at least change gears here just a little bit from talking about having kids at school being safe, but for old guys like me, that we're getting close to flu season and we need to be kind of thinking about that. And the flu vaccine, I know that's going to be coming out soon.
Yes, that will be coming out very soon. You can always check in whenever Heike Pharmacy might have some influenza vaccines. Your primary care provider should definitely, if you can, schedule an appointment to get a flu vaccine through them, or we will carry them at the health department. I don't know if we've had our stock of influenza vaccines come in quite yet, but I bet you'll hear about it when we do. And yeah, influenza vaccines are the #1 strategy in preventing influenza, especially in high-risk populations such as pediatrics and geriatrics. We recommend everyone get influenza vaccine this season. And yeah.
Because some folks are concerned about, okay, can we mix all this stuff? Okay, if I have COVID vaccine and for older folks, they have the shingles vaccine now for, if you had chicken pox when you were a kid, you should get that. And then this flu vaccine. I mean, is it okay to mix all this stuff? What does the CDC say?
It's completely okay to mix and match vaccines. Absolutely. You might go in for a COVID booster and they might give you the influenza vaccine as well. There haven't been any studies that shown major contradictions between vaccines. The only thing I would recommend is that if you are immunocompromised or have a weakened immune system, just to check with your provider to see how far in between you should wait between vaccines.
And that's probably one of the biggest things with any of these is people need to go to their doctor and talk with them about it, because it might be different for me compared to different for Rhonda or different, somebody else. So we all need to kind of just go see our doctor, and we're not talking about Dr. Google either, right?
Exactly. Yep. I'm not a medical professional. I don't have my MD. I'm not a nurse. But but we always encourage vaccines at the health department. And I would always double check with your primary care provider to just make sure that if you are going in for a vaccine, that it's a vaccine that they would highly recommend for either your age group, or if it's time for a tetanus vaccine. And then they might also encourage like the pneumonia vaccine for certain age groups as well. And they will always give you guidelines on, you can probably get these at the same time. Sometimes you'll get multiple pokes at the doctor, or they might say, let's hold off on this one while we vaccinate you for this. They will always know what to do.
That is Meghan Sickel. She's with the Pepin County Health Department. And you're listening to the Security Financial Bank Halftime Show and the Jerry Thompson Insurance Agency Halftime Show, brought to you by Security Financial Bank in Durand and also the Jerry Thompson Insurance Agency of Durand. It's Durand, Arkansas boys football here on WRDN.